The Global Brigades came to us as actually our chair, Dr. Michael Dreyer, had given me the name of the organization. And once looking into it, I realized this was a great opportunity because it's a way of mobilizing college, both undergraduate and graduate students, to underserved areas abroad in terms of supplying different things like not only medical care, but architecture, public health, in a number of different areas. So I looked into it and then formed a chapter. You have to go through a process of forming a chapter. So we formed a chapter here for Arcadia that is open to all the students. The physician assistant students were the first ones to take advantage of the chapter.
As part of mobilizing all the students, we initially had to become incorporated or an official chapter of the Global Brigades. So that was a bit of paperwork, but then it was a matter of organizing the students, getting participation, recognizing what we would need for the trip, so the amount of supplies, the amount of medications, and then trying to come up with a plan to raise funds and the medications themselves. So that was the actual kind of background to what we had to do prior to going on the trip.
The site that they actually have in Panama is in the Darien County. It's a population of about 47,000 inhabitants. There's only 5 docks in that area, so you can imagine they're pretty overwhelmed with that sort of number of people to take care of. So they depend on medical brigades to supply a lot of their medical care. So that's where we actually went to. So we flew into Panama City, then took about a 4-hour bus trip out into the very rural jungle area of Panama. So we stayed in a compound there, so we had very rustic living environments, latrines and bunk beds and mosquito nets. Yep, lots of big bugs and snakes and all that sort of stuff. At first I think it was a little bit of an eye-opening experience for everybody because we arrived in a tropical rainstorm in the dark, and we were trying to find where we were staying and getting set up in the dark. But the next day when the sun came out, we were kind of in this beautiful jungle, so it kind of gave it a different light. But I think being stripped of all these conveniences that we're used to here actually worked to our advantage. It really brought all the students very, very much together, as well as the other people. And I should say it was not just physician assistant students. We also had two docs from Abington that came with us, along with 3 outside a nurse and 2 healthcare educators that came with us on the trip. So we had kind of an interdisciplinary team.
We have a full didactic year and then a second clinical year. So at the point we decided to do this trip was December, which is about halfway through the didactic year, and we went right at the place in between the didactic and clinical year. So we literally left the day after graduation and then came back the day before orientation with the new class starting.
They actually were taking medical histories, doing procedures. The way the brigade is actually set up, there is a triage station that the patients come into initially. From triaging, then they go into the medical station where they actually get their treatment. And so the students that were involved there would then be doing physical exams, coming up with a diagnosis and working. We had 2 Panamanian docs that actually were also given to us as part of our team, as well as 2 interpreters. So we had the challenge also of the language barrier. Some of the students could speak some Spanish. Everybody got very proficient at it at the end of the week. And then from that station, after the medical care station, they went into a dental station and had dental care. And then there was a eye station where they actually had eye care, and then the pharmacy was the last station. So students were actually stationed in each one of those, and then we would rotate. So the students got a chance to at least get to each one of those stations more than once and work in each one of those. And then the last station was a health education station, where we actually we were teaching them how to brush their teeth and whatever their healthcare needs. We had certain topics that we actually talked to them about.
And I think part of what was so important about what the students were doing, what meant so much, we had been teaching them a whole year of how to do physical exams, how to learn patient history, the medicine behind what we're actually doing. We took them and put them into a safe environment where they weren't getting graded, they couldn't hurt a patient, there was feedback. and it was safe, so they could make a mistake. And it was right before they went into the clinical year where everything was so high stakes and higher stress. And I think that giving them a safe place to make a mistake and to try was huge. I mean, the difference between when we arrived in Panama and when we left, and the student confidence and their confidence in moving into the next year of clinical practice was remarkable. I think that really, for me to see that was very inspiring.
Yeah, and that was a confidence. That confidence came up in all their evaluations of the experience. And I think for us too, as faculty, to be there, alongside of our own students was also a great experience. I mean, I think the students to have their own faculty that they saw teaching them in the classroom, then out in the field with them was a wonderful experience for them. The interpreters actually worked with the students, kind of teaching, but they kind of challenged them. I mean, they actually kind of forced the students to actually speak it. And I think being immersed in it, where everyone around you is speaking Spanish, you just kind of got the courage to start doing it where, you weren't getting your hand held. The other thing too is, ironically, the patients were actually very helpful. They could see that we were trying, and many times if we were not maybe saying the right thing and through hand gestures and stuff like that, they would correct us on the terminology that we'd be using, and they were actually helping us also too. And then I think with the Panamanian doctors, they actually heard a lot of the medical terms being used, so they, were able to associate it with that.
And I think every evening we had a debriefing session. We'd sit in a circle and we'd kind of talk through what happened today, what did you think about it, how did you feel? And every night, several people would say, a patient smiled at me. Just that smile, that human connection, even though we didn't speak Spanish, they didn't know the right medical terms that I was asking, and there was definitely a language barrier. The smile of a child, the smile of a patient, and knowing that you're making a difference was enough. So I think that, there's definitely a language barrier, but the human connection that they found was, it was remarkable.
On the last day of the brigade, we had the opportunity, the way the Global Brigades actually is structured is that then they bring the students up into the villages where the actual patients are coming from. And so they were able to see their living conditions, and they were able to see some of the cultural experiences that they went through. And that was a great eye-opener for them. I think when they saw that where some of these patients walked 2 to 3 hours to get to the clinic that we were at, it really struck hard with them. So it was kind of this total immersion for them. They had this language immersion, cultural immersion, and then obviously the medical immersion. So it was all of those. And I think that was what they really took back from it. They really, it was a valuable experience that they could have never gotten, I think, back here through some of our other clinical experiences.
I think they also learned about teamwork. I think from the start when we set the deadlines of what supplies needed to be collected, the medications, working together, that carried into all the packing and organizing supplies, taking the bags, getting to the airport with 50 bags full of supplies and trying to kind of organize all that, even into being supportive of one another and realizing that, there's going to be some hardship. I woke up one morning and found out that there was a snake right outside my shower that someone had just killed. And that was a little bit traumatic. And you kind of realize that, in your day-to-day life, if there's something that doesn't work, you can tend to find a way to solve it. You could change the situation. Here we were in the middle of the jungle, and there wasn't anything we could do besides go to bed and wake up the next morning and keep going. And so I think the students, as much as there were things that were difficult, learned how to persevere and kind of keep working through that. And I think that will serve them well. There may be rotations that are difficult, clinical practice it's difficult. It's a good life lesson for them to learn. And I think the confidence walking into the clinical year instead of fear is a huge step up for them. Rather than feeling burnout from the first year and feeling kind of like, I'm not sure what's going to happen next. I've already seen 10 patients. I'm ahead of the game. I already know what's going to happen. And I think that that was a good experience as well.
Yeah, and I think that too, where can you go for a clinical experience where you're seeing like 150 patients a day? That sort of volume for them to see, and that they were seeing, infectious disease things that they don't see here in the States. The other thing I think that was really, there was obviously a lot, with that group of people, there's a lot of different personalities. Not once was there any time that I can remember where there was any cattiness or any arguing. Everybody through the whole experience was very, very supportive of each other. And whenever there was anything to be done, everybody just pitched in and did it. There was never any question about it. And that was for both of us, that was a remarkable experience to sit back and watch and see a team come together that well. There was no role playing. Everybody just kind of did, whatever they had to do to get the job done. And that was really nice to see. There was a woman that actually came, she was actually from one of the islands. So for them to actually get there, they had to take a boat over to get there. And then she walked another 3 hours to get to the clinic. And she came in complaining of abdominal pain. Well, she was actually having contractions and she was getting ready to deliver. But she didn't even, I think, realize all that at the time. So, here she is walking in bare feet 3 hours after taking a boat to come over there, to see somebody have that sort of determination to get in there. And it made us really realize that they don't have the medical care that they really need, and that we really were making a difference for some people like that. Out of all the PA programs across the United States, we found out in terms of the global brigades that we're the only PA program that has done something like this in the didactic year. So I think that's a really valuable experience for students. There's so much curriculum packed into that first year of any PA program. So for the students to have a clinical experience like this at the end of their, in this transition period between the didactic and the clinical year is great. The other thing too is, it fits with obviously the Arcadia mission of being global, and taking initiatives on like this. And so I felt very proud that we were actually able to contribute to something like that.
I think as a PA, it reaffirmed that people are people. It doesn't matter what setting you're in. If you're rural, urban, affluent, poor, it doesn't matter. The basic skills and the compassion and the interest in working with patients carries over to wherever you are. I think as far as an educator, it's something I would like to see continued because I feel like it was so valuable. I think that the immersion and the cultural awareness, it's difficult to read about a group of people and try to really understand where they're coming from, and to be in the setting and to see the way they're dressed and the environment that they're in and feel the heat and the humidity and all the other things that kind of contribute. Maybe the reason the person is dehydrated is because there's no clean water to drink, or whatever the reasons were. And I think that as an educator, I would like to see that continued, but for me personally, to be able to see in our program, we spend a lot of time in the didactic year, not so much in the clinical year. That's not our role. So once we get the students kind of ready to go into clinical practice, we don't really see what they're doing. And for us to be able to witness them in clinical practice, as an educator, for me to see the application of what I've been teaching was fantastic. The clinical practice, I don't think was as valuable to me, but to see application of what I had been teaching was kind of sum things up for me as an educator. I thought that was fantastic.
There are other sites that Global Brigades have. They have a site in Ghana. They have a site in Honduras. They have another site that it's a newer site that opened up in Nicaragua, I believe. So I think one of the things we're going to be doing is exploring maybe the possibility of some of the other sites. And then, we're looking at medical, but obviously the nice thing about it, we had some of our dual degree students go with us that are both public health and PA. So they have PA brigades. So I would like to see in terms of Arcadia that we do more multidiscipline teams, and that we maybe look at some of these other brigades in terms of actually doing stuff like that. If you ask any of the 19 students that went abroad, they all were, if they could do it again, they would. One of the things I think that was really nice to see is that as the students went through the fundraising process, they were welcomed with support from now other professors from other departments, students, both undergraduate and graduate students. They had a couple fundraising events where they asked the PT students to actually come out and support them, and they came out in full force to support them. Our dean was very helpful in terms of supporting them monetarily for this sort of endeavor. And the one thing that we did is it was the first phone-a-thon that it was actually student run by our PA students, actually calling our alumni, telling them the project that they were doing, and we got some great response from our own physician assistant alumni in terms of support. So that was really great to see how everything came together in terms of the support that we got from the whole community here.